Hold on. Can we switch the language?
Hi guys, welcome back to my channel. I am Cindy, your pharmacist, and this is Health Talk TT. Today's Couch Talk, we're sitting down with Mrs. Chylana Brown, Clinical Psychologist, and we're talking about how we as Trinbagonians are coping with the COVID-19 pandemic and how mental illness is affecting us all. So, Mrs. Brown, tell us a little bit more about yourself.
So as you said, my background is in clinical psychology, so I do both psychotherapy as well as assessment. And basically what we do is we help clients get the skills necessary to help them to function more healthy. That's it.
So do you deal with any medications at all?
No, I don't. I actually do referrals for medication to psychiatrists, but I
Lovely.
don't do medication.
So you are dealing with more holistic care,
Yeah.
talk therapy.
Talk therapy.
Lovely, and that's exactly where we want to start this evening, because I've been observing a lot more persons by my window who just don't seem to be able to cope. I don't necessarily have the time to speak at my window.
Yeah.
It's very fast paced, it's government service, it's come go
Yeah.
quickly, but it's good to know that there's a place that they could go.
Yeah,
Definitely. Where talk therapy is encouraged.
Yeah.
Right? So let's drop right into the interview. First question, from your experience, how do you think persons are coping with COVID-19?
Well, we have to recognize that the pandemic is something that is an ongoing threat. So usually when somebody comes into a situation that might be fearful, they have a trigger and it presented in front of them, and then they might respond. As you know, the flight or the fight response,
Right.
they might respond appropriately. But with COVID-19 is an ongoing chronic threat, so it's constantly there.
Yeah.
So persons may cope different, but you know, the fear and anxiety is a normal response.
Yeah.
However, when that fear and anxiety gets to the point where you're not really functioning well, or you feel like if you're paralyzed with anxiety, that you can't get it, you can't go to work, then
Right.
it becomes a problem. From my experience, the coping may not be as well with some people because their avenues by which to cope no longer exist, especially during our lockdown and partially lockdown periods.
Right.
When they could have gone now, probably we have a very lively society in Trinidad. People would have probably previously gone hang out with friends, have drinks with friends, go to the beach, etc. They didn't really have these avenues anymore.
Yeah.
So then you may have see things like increased alcohol use, people going into substance use, illicit drugs, that kind of thing. Or that's kind of like increasing these unhealthy coping strategies that are probably not the best. You know?
Yeah, because I guess most of the times they have nothing else to do.
Correct.
And their mechanisms, as you rightfully said, they have been removed. And in speaking with some of the physicians in the outpatient clinic, so outpatient clinic setting is not where we have patients on the ward. These are persons who are going back to their homes. They're coming in for medication, they're being maintained, but they're going back home. We're seeing a lot more persons coming in, a lot more. But I can tell you what I've been dispensing. Anxiety meds, depression meds. It's going much more quickly than before. And it's like, are we as Trinbagonians, are we coping? Are we okay? And are we addressing the issue of mental illness in our society as it pertains to COVID-19? I don't know if we're doing enough.
Yeah. And what you mentioned is important as well, because what you recognize too is that persons who have previously diagnosed conditions, they'll be more at risk for relapse at this time, because they'll be triggered by whatever is happening, whether it's financial issues, part of the job, security, but there's a fear that you might have the illness or your family member or grandparents or mom might have it. So it's a constant pressure that might be causing some relapse. That is probably why you might actually have to see persons more often as well.
Yeah. So what aspects of COVID-19 do you think are most challenging for persons?
I think definitely, as I mentioned before, we have fear. Fear because of the uncertainty. So we don't know what's going to happen next year. We don't know what's going to happen this year. Even in previous times, as I mentioned before, that persons may have felt kind of secure in a job position, or they might have a permanent job that no longer
exists.
Exactly. So now you're concerned about having your basic needs met. Something simple that's help us to feel your basic needs met, you're concerned about whether you or your family might even get the illness, if you're able to function later on, if you do get the illness, if you will possibly die. So death is an actual factor here, so no fear of death happening as well as we have things coming up, like for example, professional boundaries not being there. So like beforehand, you could leave work at 4 p.m., 4:30 p.m. most people, and they're fine. Now your manager has access to you all the time, so probably at 6 p.m. they expect. Because you don't have the stipulated 8 to 4 work situation. You see that people. Managers are really respecting some person's time because they themselves are under some distress as well. So lack of professional boundaries, we have fear, the uncertainty, loss of control as well, because you can see that before human beings like to feel like if they're in control. So it's like, I know what's happening next week, I have plans for 2020, I plan to travel, I plan to do this, I plan to get married, and just like that, it's just taken away.
One by one, they're just being removed.
So my wedding I have been planning for 2 years, no longer is going to be happening again. My plan to Paris or whatever, Tobago, whatever else you were planning to do, could no longer happen. So the loss of control in itself is quite challenging because you don't even know how to even wrap your mind around that.
And for some persons, having a healthy conversation helps.
Definitely.
And then for some persons who are already on the edge prior to COVID-19 or already on medication, for instance, patient X who's already on anxiety medication and she comes once a month to get her prescription refilled. This is prior COVID. COVID happens, now patient X who's already on edge now has to deal with the reality of COVID and everything that you just explained. So whereas some person may begin to have anxiety attacks, the person who is diagnosed with anxiety is now in a very scary, dark place because now everything around them feels like it's coming in. And they could possibly relapse very well. So something else that I've also noticed, and I think we all have, is that COVID-19 has kind of flattened the curve. There's no high and low end. There's just everybody suffering with the same pandemic. Have you seen that flattening in your clientele? Have you seen a change, or you're seeing a wider range of persons coming in for help, persons who you never thought would be in front of you? Is that happening?
Definitely. So psychological issues definitely do discriminate. I'm not really surprised because even before COVID, we have people from all areas of life, you know. So we have persons, I mean, COVID-19 will affect people differently, meaning that one person might lose their job and one person might already have the means to buffer. Even if you lose your job, it might be okay. So your situations might be different, but definitely mental illness doesn't discriminate, because when we look at mental illness, we can see that it has to do more with, you know, brain chemicals coupled with possibly intertwined with some environmental factors, possibly intertwined with some predisposition from genetics and that kind of thing. So definitely anybody could have this response, this unhealthy response, or this negative response to COVID-19.
And it's a reality that we have to accept. I remember when I just started at St. Anne's, I remember although I knew that there was no face to mental illness, in the back of my head I was still expecting a certain type of person to come to my window. And I've been there almost 2 years now, and I've seen old, young, I've seen employed or unemployed, I've seen the rich, and I've seen the poor, and professionals, persons who are going to work, so they come to clinic before, get their medication and go. And it's amazing now that this pandemic has happened and our eyes seem to now be open to everybody possibly being anybody, can happen to anybody then. Basically, the nervous breakdown doesn't have to happen to the quote unquote unkept person on the street. It can happen to you, well dressed in your office. Things that COVID-19 has highlighted is how anyone could have an episode or suffer from some aspect of mental illness. And I think now we are paying more attention to it. We're starting conversations about stress management and dealing with depression, and that was not so prevalent before. So a positive, if we're able to find positives in the situation, is that conversations like these are happening more.
Still more to be done.
Yes, of course, always more to be done, but society is now waking up to the reality that we need to have these conversations. So as we close, the last question I want to deal with, now that we know what are some of the issues that we face with as a society, what are some things that we could do to avoid falling prey or falling into these situations?
Well, what we could actually look at is if you recognize basically that fear has been causing you to have increased anxiety and you feel like you're not really coping well, it might be important to limit the amount of information you're taking that is negative on a daily basis. You want to also ensure that you're taking information from trusted sources, like Ministry of Health and the WHO, as opposed to random WhatsApp messages or Facebook things.
Those chain messages.
Death and whatever, that kind of thing. We also want to look at using your support system as a means to kind of explore emotions, to talk things through. You also want to ensure that you're actually taking good care of your physical health as well. So diet, exercise, and you'll be dealing with some of these things I'm sure in other segments as well. But definitely your physical health impacts mental health, as you would know. So insufficient sleep and so forth. We want to keep a new routine because we recognize that there's some changes in our schedules. So maybe a different routine now, instead of hoping to get back the last one, but establishing a new one might actually help. Finally, I mean, we have so much things that we can do, but finally we want to also have a plan for your fears. So we spoke about before having a loss of control and how that could be kind of difficult to work with. What we could do is plan for your fears. So if you recognize that I'm fearful that I wouldn't have, so and so amount of money by August or whatever, you want to make sure you save towards that, or you look for different income, or maybe a side business or whatever you have to do in order to plan for those uncertain situations that you're not really sure about. But finally, and most importantly, you want to recognize when you're not able to cope anymore. So when you realize that you're actually paralyzed with anxiety, or you feel you can't really function, basically when functioning is not where it's supposed to be, get help. So seek counseling, and I will actually hope that after the video I'll probably give you some insight into some places people can actually check out.
Definitely.
So
definitely the description bar below.
So definitely suicidal thoughts, you need to get help immediately. Things like as I said before, not being able to function, you can't go to work, you can't take care of kids, you can't do things that you would previously do before, and you recognize that things have been getting increasingly worse psychologically, and they actually need to get reach out for help, definitely. So by a counseling agency, by a psychiatrist, etc.
And that's such a perfect way to end the interview, because it's so important that we know as Trinbagonians, it is okay to say that I need help. It is okay to say that I am no longer coping. It is okay to say, to ask a friend or a family member, do you know of somewhere I could go? And we have resources here in Trinidad and Tobago, and they're probably not as advertised as we would like them to be, but we have resources, and of course I'll be linking everything in the description below, so feel free to check out the website, check out the information, call the numbers, visit the places. If you feel like you need help, or you have a family member that you're living with who you've realized they could no longer cope, please, as Mrs. Brown advocates and as I advocate, don't wait until it's too late. Seek help now. Guys, thank you so much for joining in on today's Couch Talk with Mrs. Chylana Brown, Clinical Psychologist. Today's conversation was a very necessary one. I feel as though more persons in Trinidad and Tobago need to be aware that there's help. They need to be aware of some of the things that they are dealing with, and they need to know that there are people out there and resources out there to support them. So thank you so much for tuning in. I have just given you the building blocks. Go build a better you.